This is Katerin with VIVE Katerin. I'm here in New York City at the Hotel Pennsylvania with the Color of Teal for the Ovarian Cancer Expo. Let's go in and check it out.
But I was 39 that summer when my zippers wouldn't close and the shape of my stomach suddenly changed. A veteran gastroenterologist to whom I'd been dispatched sent me for a transvaginal ultrasound, and the radiologist knew immediately what was going on. Within a short time, my husband and I conferred with 2 gynecologic oncologists, chose the one who was candid yet hopeful, and got started on a medical odyssey that lasted a year and a half and included both gold standard and experimental treatments, one of which, weekly Taxol, has since been proven effective for many women and is in wider use today. Now, I don't mean to minimize the low points, and Genese did ask me to talk about weaknesses and low points, and I glossed right over that, but I'll talk fast. The low points. The anguished look on the face of my husband, my soulmate, at our dining room table when I burst into tears when I first broke the news. My dismay, same table, when I suddenly came home and found him crying as he read the test results and surgical reports. He's a literature professor, but he had spent a year in med school, and he comes from a family of physicians, and they were telling him what to expect. The first time I took a good look at the scar from my first surgery and blubbered away as I told a very sympathetic nurse that I was worried my little girl would see it and be scared. And finding ourselves at a treatment crossroads when the prevailing consensus of our doctors was that there was small-scale disease, that recurrence was pretty much inevitable, and the choice of what to do next, if anything, was all ours.
I'm here with the president and founder, Genese Valentine. How are you?
I'm great. How are you?
I am doing great. Thank you so much for having this amazing event. Great keynote speakers today. Tell us a little bit about how you actually founded this organization and what it means to you.
This organization means the world to me. I started this organization because of my mom. She lost her battle with ovarian cancer 10 years ago. This month, September 7th, marks her 10th year anniversary, and so as a tribute to her and also in an effort to raise awareness in our community, I started Color of Teal.
So tell us a little bit about what the Color of Teal does as far as outreaching to the community to spread more information, more knowledge on this particular topic, ovarian cancer.
Many organizations, and I'm not faulting any others, they don't do community outreach, and I go into the communities and I let them know about the symptoms and to pay attention to their bodies and listen to the quiet screams that their body gives off, because many times our body gives off signals as to telling us, what's wrong. Like mainly, if you have a headache for more than 3 days, you have a migraine. But if you have cramps for more than 3 days, we usually take Advil and we kind of shrug it off. So I started this organization to tell women to be more aware of themselves.
I'm here with Dr. Boyd with Yale School of Medicine. How are you?
Very good, thank you.
Thank you very much for being a part of Color Teal today.
My pleasure. It was a great opportunity to speak to a very important group of cancer patients and survivors.
Absolutely. Dr. Boyd, I know that you had spoken about the impact that weight gain and diet has on ovarian cancer. Can you elaborate a little bit on that and give our ovarian cancer patients advice on, what that impact would look like and what that advice is?
My focus was on looking at the entire issue of lifestyle, diet, weight as part of this, related to what's called energy balance. Ovarian cancer may be a little different from the others, where the weight may have a lower role. And of course, the problem with survivors of ovarian cancer is they can lose weight because they're unhealthy. And so unhealthy weight loss may actually have adverse effects. But weight gain itself inappropriate weight gain may also have adverse effects with obesity. More importantly, the critical role of exercise in giving you a healthy body composition and muscle mass may make you overall healthy and change your long-term survival and reduce not only potentially ovarian cancer risk, but also other diseases that you're at risk for from your treatment.
And Dr. Boyd, also, what are you doing to reach out to the minority community about this particular topic?
I am very interested because I talked about nutrition insecurity, and I talked about the population I often see are the opposite. They're the upper middle class, Caucasian populations in Lower Fairfield County, and my biggest concern is getting the message to minority populations where weight control, exercise may be less on the they may not be aware of this. And they really need to learn this to help them to adopt healthy lifestyles, help them with finding ways to get healthy foods instead of going to the local fast food store. How do you get and have adequate diets that will match what we know are helpful?
I'm here with Dr. Nimaroff from North Shore University Hospital. How are you today?
Okay, very good. Thank you.
Thank you so much for taking the time out to make it here to talk to a lot of the patients and our guests today on ovarian cancer.
Yeah, it's my pleasure. I mean, to have the opportunity to talk to and hear from patients who have been through some very difficult times. It only helps us as practitioners to really hear from them, and then obviously to share our own experiences with them, and hopefully to bring that back with our other patients.
Absolutely. And Doctor, I guess one of the questions I have for you is with the new technology and the new screenings that we have, can you tell us a little bit about what those screenings look like?
Well, again, unfortunately, as just recently we've seen in the press, our current screening methods for ovarian cancer are really not very useful. So clearly there's a lot more that needs to be done. And as I like to say, this is the importance of screening is it's team effort. It's really identifying our patients who really are at significant risk, and when necessary, offering genetic counseling, and at times even risk-reducing surgery.
And Doctor, can you also talk to us about the connection or that link between breast cancer and ovarian cancer?
We were fortunate enough here today to hear from doctors discussing dietary issues, some weight issues, exercise issues that are potential sort of precursors to developing, all cancers, but specifically breast and ovarian cancer. So many of the causes or risk factors for developing breast cancer are also true with ovarian cancer. In addition, the genetic Cancer Association called BRCA, the gene BRCA stands for, it's a breast cancer antigen gene that has been identified, has really been identified in families who have both breast and ovarian cancer, and patients who carry this gene are at significant risk for both.